Personal knowing and cognitive biases. We would like to acknowledge that we live on the unceded traditional territory of the Tsimshian people and the traditional keepers of their land. So in this PowerPoint, we will be looking into more about what personal learning is and how it can really affect or impact our work ethics and our relationships we have with our patients. Secondly, we will also be looking upon how the BCCNM guidelines relate to our topic. Along with this, we will also be talking about the relevances with personal knowing and cognitive biases. Lastly, we will be looking more into related concepts with our project. So, what we know about personal knowing and our biases. So, personal knowing requires you to be in touch with who you are and actually understand who you are as a person affects your behavior, attitudes, and values. This can be both positive and negative. If your behavior is bad, your attitude is poor, and your values, you tend to push your values on other people, this can be extremely negative for people around us and for our patients. Let's say if you know who you are, you're in touch, you understand yourself as a person and how your attitude and behavior may affect your patient. And you also understand your own values and how that might impact your patient. That is a positive view because you know that to have a positive relationship with your patient, you have to push aside your own values. Your behavior has to be good, and your attitude also has to be good. So it is much more than knowing basic characteristics which define who you are. You can't just say, oh, I'm a happy person. It doesn't work that way. So biases can occur when people interpreting information in the world around them, and it affects how they make decisions. So if there are biases that are happening around them, and let's say it's a bad bias and they believe that, it's going to impact how they make decisions. Moving on, personal knowing is very good for healthy relationships, as I said. If you know your values, you know how your behavior and attitudes may impact someone, you are more mindful of that going into a conversation. So how can we extend this to our professional area of knowledge? As I already said in the previous slide, it can extend personal knowing just by remembering how we're going to respond and also our strengths and weaknesses. Being aware of our individual biases and not putting that on our patients. Also remembering how our biases and personal knowing may affect the quality of the nurse and patient relationship. Personal knowing in nursing promotes healing and therapeutic relationships with the patient. Also, some biases may lead to neglect for patients and improper care. Let's say if you have a bias against a culture and you are going to care for a patient who is in that culture. You're not going to give the best care you can if that bias is bad. It's very important to push aside these biases when going in to nursing. Also remembering, as I said, just to push your biases aside in order to give the patient the best care possible, and being honest with yourself and with your manager and your coworkers if a mistake was made, and also fixing that mistake and fixing the problem and also reporting it. Knowing what we are doing and doing what we know, not doing something that involves a patient that we do not know. We want to know how to do something, we should have the proper training. So we only stick to what we know. We don't want to push someone to do something that they might not know how to do because that can lead to a mistake that could be fatal. So just relates concepts that might be being studied or presented. So concept of being in touch with who you are, understanding who you are as a person, as I said before, awareness and knowledge of the nurse about the personal characteristics of herself/himself and the patient. So an example would be like a patient is explaining their pain tolerance level even if they aren't in immediate danger or will soon recover. As a nurse, you're showing empathy, even if you know in your head, oh, they're not in pain, it doesn't really look like it. It's just like giving that support that they might need. Bias research may include trusting someone more if they're an authority figure than if they're not. It's been shown now that some people may not really trust the authority figure like a doctor. They might want to talk more to a nurse. And making sure just to remember not to put a label on them or yourself and keeping it equal. Assuming someone's gender based on their profession, and knowing what you do and doing what you know. And if you want to pause, there's just some diagrams about like some personal knowing, some learning, and a bunch of stuff.
Personal knowing and cognitive biases. So what is personal knowing? Personal knowing demands you to be aware of who you are and comprehend how your personality influences your behavior, attitudes, and values in both positive and negative ways. Cognitive biases, on the other hand, are preconceived notions or opinions that nurses may have about a particular patient or group based on their personal experiences or societal influences. So how do cognitive biases impact the care that we provide to our patients? These prejudices may affect how nurses view and relate to patients, possibly resulting in unequal treatment or a lack of comprehension. It is essential that nurses remain conscious of their own prejudice and actively seek to provide fair, impartial, and equitable care to all patients. This makes it possible to guarantee each patient is treated with the same respect and care, regardless of their history or identity. The BCCNM professional standard that relates to personal knowing include client-focused provisions of services as well as ethical practice. Client-focused provision of services requires nurses to provide nursing services and collaborate with others to deliver health care in the patient's best interests. This relates to personal knowing and cognitive biases because nurses are expected to provide care that is respectful, inclusive, and culturally safe for all individuals regardless of their background or their identity. When nurses are on shift, they are required to provide care to all individuals to the best of their knowledge regarding their practice. Ethical principles recognize, uphold, and support nursing profession's ethical standards. This guideline helps to ensure nurses are making informed and ethical decisions based on their current knowledge and of care and ethics. This helps to ensure that the patients that we as nurses care for are provided with safe and respectful practices. An additional BCCNM professional standard related to personal knowing includes the duty to provide care. This standard ensures that nurses accept responsibility, act responsibly, and ask for help when it is required. In all encounters, nurses must act professionally, with confidence, honesty, integrity, and dignity. Nurses solve ethical and moral issues using reasoning, and they seek support when they are aware the concern surpasses their current abilities. This relates to our personal topic because nurses need to constantly update their knowledge and skills to deliver the most beneficial care to those who they work with. By reflecting and recognizing when assistance is required, using collaborative tactics to help ensure that the safety and well-being of the patients is being attended to. By recognizing when you have gaps in your knowledge, it provides room for learning from others and allows you to expand on collaborative opportunities. On the other hand, BCCNM practice standards that relate to personal knowing include professional responsibility and accountability and knowledge-based practice. In order to deliver safe and competent care, nurses are required to continually enhance their professional and personal knowledge and biases, abilities, and judgments. This applies to our current discussion since nurses are accountable for their actions, choices, and professional growth. Nurses may deliver high-quality care, represent their patients' interests, and uphold professional standards of practice by consistently expanding their personal knowledge and staying up to date with evidence-based practices. Knowledge-based practice is a guideline that emphasizes the need for nurses to incorporate the best practices, evidence, and research into their decision-making and care practices. It highlights the significance of staying current with information and actively searching out opportunities for professional development. This relates to personal knowing because nurses are encouraged to combine their own experiences, values, and instincts with scientific knowledge as a part of their own knowledge-based practice. This supports the delivery of specialized care and helps nurses make well-informed decisions.
The relevance of personal knowing. The nurse engaging in personal knowing promotes intentional, therapeutic, healing relationships with the patient. Patients and nurses feel connected with each other, and patients experience caring and compassion from the nurse. Engaging in personal knowing requires the nurse to be authentic, present, and mindful so they can deeply focus on the current situation. The nurse seeks to understand their own and the patient's narratives as they relate to the patient encounter, and they are aware of their own biases and experiences that could influence healing relationships. The relevance of cognitive bias. Cognitive bias negatively impacts clinical decision-making and contributes to poor health outcomes. Nursing decision density is high, so it is likely that over hundreds of clinical decisions made each day, bias will impact almost all nurses' practice in one way or another. It is worth reflecting on factors which increase the chances of a cognitive bias occurring. For example, fatigue, lack of experience, decision fatigue, stress, and distractors. Patient safety is greatly influenced by cognitive bias in language. For example, how information is presented or gathered and then put together by clinicians to form and communicate diagnostic decisions. Application of knowledge to nursing practice. These types of inner knowing of the self are essential to nursing holistic practice and are a key means by which nurses demonstrate their unique contributions to patient outcomes in healthcare. Personal knowing enables the nurse to identify his or her responses, strengths, and weaknesses in a situation and to be aware of the individual biases affecting the quality of the nurse-patient relationship. Nurses apply patterns of knowing in 3 ways in their clinical practice: cohesion of patterns of knowing, domination of some patterns of knowing, and elimination of some patterns of knowing. The core variable of this process is cohesion of patterns of knowing in the domain of flexibility. Nurses must learn to empathize with patients and their families as they face difficult illnesses or injuries. Nurses need to put themselves in their patients' shoes so they will have the sensitivity and awareness to address not only the physical needs, but mental and emotional ones as well. Related concepts. The fundamental patterns of knowing in nursing, including empirical, aesthetic, personal, and ethical knowing, and this marked the beginning of a new phase of thinking among nursing researchers. Basic patterns of knowing encouraged nurses to identify the art of nursing work and the importance of understanding the complex nature of nursing practice. Empirical knowing is formally expressed through facts, models, theories, and thematic descriptions. Ethical knowing focuses on the ethical components of nursing practice and tries to answer the question of what is right and what is responsible. Aesthetic knowing, or the art of nursing, is achieved through empathy, dynamic adaptation, and understanding of the components as a whole, as well as the recognition of specific cases rather than holism. Emancipatory knowing, as a 5th pattern of knowing, is the capacity to be aware of society, culture, and political situations and to critically reflect on these issues. This critical awareness and reflection is needed for change towards social justice.
To conclude, personal knowing and cognitive biases are a huge part of nursing practice and should be considered before going into the field. It is important for us to understand how our own biases and personal knowledge impacts the therapeutic relationships we build with our clients. On top of this, personal knowing can be related back to the BCCNM guidelines. Everyone should be putting the patient first and knowing how their personal knowing impacts the people around them.